Imagine needing medical treatment, but being told that the government has created laws that could dictate whether or not you receive said medical treatment. This is a reality for many women across the globe today when it comes to abortion, abortion bans, and abortion restrictions. Abortions are considered medically safe procedures when done by trained professionals in safe environments, and as long as they use the medically based and proven methods that are safe for women. While many may think that abortions are not important to them or have no personal impact to themselves, I believe that abortions and abortion restrictions are something that we should all care about, because access to healthcare and bodily autonomy are incredibly important and should be considered fundamental rights. I myself, as a woman in America, have kept up with the laws and restrictions that have been placed on abortions, as all these rules and restrictions continue to change through the years and state by state all around the world. The different rules and restrictions are being changed, and it is important to keep up with it. I have also done a lot of research and reviewed multiple articles that have been uploaded on medical journals that are peer reviewed by professionals. I've also reviewed and read articles that have been written by the World Health Organization and that have been written by the Institute for Women's Policy Research. While many may believe that abortion restrictions prioritize women's health and actually reduces the rates of abortions being performed, that is not true. The amount or the rate of abortions being performed do not actually decrease. If anything, the amount of unsafe abortions that are performed actually increases. Today I will be discussing why restricting abortions or banning abortions does not actually stop abortions from happening, but only pushes women to seek unsafe abortions and raises the rates of unsafe abortions that occur. I'll also be speaking on how dangerous it is for women to be denied a safe abortion due to abortion regulations, and how dangerous it is, and how again it forces them to unsafe abortions, and how dangerous it is for them mentally. I will also discuss how it is difficult both socially and economically on women for all these abortion restrictions to be placed. To begin with, we need to understand why abortion restrictions and bans are so dangerous. If you see, limiting access to abortions pushes women towards unsafe methods or unsafe abortions. It is actually stated in a medical journal that the states with the highest forms of bans or restrictions actually have a higher maternal mortality rate. It is actually stated as well that the 10 states with the lowest maternal mortality rate actually have no bans placed or very, very low restrictions placed. It was also seen in a research done by Gender Equity Policy that the state of Texas, that has one of the strongest bans on abortion, one of the strongest restrictions on abortion in America, has actually seen a very, very large rise in the maternal mortality rate. It was seen that from the years of 2019 to 2022, Texas actually saw a rise of 56% in the maternal mortality rate, which is considered to be an extremely, extremely high percentage. Compared to the national average, it actually only raised 11%, but Texas raised 56%. It is seen that when women do not have as much access to a safe abortion, they are forced to seek elsewhere or carry an unwanted pregnancy to term, which can be dangerous and can be mortal. It was also seen that restricting abortions pushes women to seek alternative methods to ending an unwanted pregnancy, whether that be performing the medical procedures themselves, or seeking other sorts of abortions through the internet. It was also seen that it pushes women to seek unsafe abortions, whether that be going to a clinic that is not not trained in abortions, or forced to carry past a safe point. There are many reasons as to why a woman may need an abortion, may seek an abortion, and forcing them to wait to have access to said abortion, or forcing them to have to carry to term, it can be mortal. Next, you will see on how restricting abortions is incredibly mentally unsafe for women. It was seen in a peer-reviewed medical journal that medical abortions are actually 14 times more safe than pregnancy itself. There are both abortions that are medical procedures, where a female is induced. That is more of a medical procedure that is done. There's a D&C that's done, but there's also medicine. There's a medicine that can also forces a female's body to pass a fetus. The medical or the medicine abortion is actually 4 times safer than pregnancy. Forcing a woman to carry to term, again, can be extremely dangerous, as there are many reasons as to why a female may want an abortion. It was actually also seen that females that were allowed abortions, females that had access to abortions, are actually very happy with their decision. They do not regret their decisions. They live happy lives, and they are safe. Women who may not have wanted an abortion but were forced to due to deformities in their fetus were later able to have children later on because they had access to said medical care. It was seen that compared to those women who were denied abortions and medical treatment are actually more likely to face mental health challenges, and are more likely to be considered to later on experience more challenges in their personal lives, and many times since they are forced to find alternatives, it is a lot tougher on them mentally. We will move on to speak on the social and economic challenges that a woman may face. If a woman has lives in a state where there are many restrictions on abortions, or when there is a ban on abortion, they are forced to seek elsewhere for an abortion, which again can lead to seeking unsafe abortions, whether that is performing them themselves or having to cross state lines to be able to have an abortion. Having to cross state lines to have an abortion can be very economically stressful on a woman. The public health research that was done can be seen that women who were forced to cross state lines or to wait actually experienced very hard financial struggles, and they seem to have many struggles with poverty, with job stability, and are seen to barely be able to afford to have an abortion. It is extremely expensive to be able to cross state lines or to be able to wait the wait times. It is very unsafe for women to be traveling as well sometimes, because again, there are many reasons as to why a woman may want or need an abortion, and it is incredibly unsafe for women to wait to be able to have access to that care, which then pushes them to have to seek unsafe abortions in their area. After reviewing all of this information, we can see that the restrictions and bans on abortions do not only force women to seek unsafe abortions, but it puts them in unsafe situations, both mentally and physically, and actually financially and socially. It is incredibly difficult on women in more than one way. And I think that if our main goal as a society is to protect women, is to protect women's health, again, both physical and mental health. If that is our goal, then we should do that, and we should prioritize that. And we should prioritize their safety first and foremost, which is why there should not be as tough and hard restrictions on abortion as there is now. It only pushes women to have to reach out and seek very dangerous and unsafe abortions. So, as we can see, putting very harsh abortion restrictions does not stop abortions from happening at all. A woman will find a way to have an abortion, whether it is safe or not. Some women sadly do not have the choice on whether they need the abortion or not. Sometimes it is very much a medical issue, and again, if we are prioritizing our women, then we should prioritize their safety first and foremost, and should not place so many bans on abortions, because it only pushes them to have unsafe ones. Thank you.